Hi, I'm Madeline. I'm going to be your nurse today.
Hi.
Can I get your name and date of birth?
Caitlin Walker, 22797.
Okay, and how are you doing today?
I'm good.
Okay, can you tell me what today is?
It's October the 3rd.
Okay, can you tell me what you had for dinner yesterday?
I had chicken.
Okay, and do you know where you are?
Yes, I'm at the doctor's office.
Okay, so I'm going to give you 4 words. I'm going to give you a couple minutes, and then I'm going to ask you to recite those back to me, okay?
Okay.
So the 4 words are going to be pineapple, pizza, chair, and table.
Okay.
Okay, so the patient is awake and alert and oriented to person, time, and place. She makes comfortable eye contact. Facial expression is appropriate for the situation. And her speech is moderate and clear. Also, do you have any health history, past health history?
No.
Okay. So what I'm going to be doing today, I'm going to be doing a head-to-toe assessment on you, okay? Before we begin, I'm going to wash my hands, but do you have any questions?
No.
Okay, so as we go throughout, if you do, just let me know, okay?
Okay.
I'm also going to be shutting the door to give you some privacy.
Okay.
Okay, so can you tell me those 4 words that I gave you earlier?
Yes. Pineapple, pizza, chair, table.
Okay, perfect. So I'm going to start out by taking your vitals.
Okay.
We're going to take your pulse first, actually.
Okay.
Okay, so your pulse is 70, which is within normal limits, and then your respirations are 16, which are also within normal limits. Now I'm going to be taking your blood pressure. I'm going to just get that a little bit tighter on you. Your blood pressure is 118/70. So I'm going to be doing just a skin assessment. Do you have any tattoos?
I don't.
Okay, have you noticed any rashes or anything recently?
No.
Okay. Okay, so your skin is warm and dry and appears to be intact. It is also pink. So now I'm going to be moving up to your head, okay? So your head is normal cephalic. I'm going to be looking at your scalp. There are no lesions, without parasites. Hair is brown, it is not too oily nor dry, and then hair is also evenly dispersed. And so now I'm just going to be kind of moving back down to your face. So your eyes are the upper third of the face, and the mouth is also the lower third of the face. The nose is midline, and everything is symmetrical. So now I'm going to be checking your trigeminal nerve, okay? So I'm going to have you do is I'm going to have you close your eyes and you just tell me where I'm touching, okay?
Okay. Left cheek. Right cheek.
Okay, so trigeminal nerve is intact. So now I'm going to be moving it to your jaw. So I'm going to check your jaw strength. So I'm going to just press on your jaw and you're going to bite down, okay?
Okay.
Okay, so jaw strength is strong and bilateral. So now I'm going to be doing your facial nerve. So I'm going to have you blink 3 times for me.
Okay.
Okay, can you smile? And then can you frown? So the facial nerve appears to be intact as well. So now I'm going to be looking at your nails. So nails are convex, they're translucent, there is no clubbing. Capillary fill is less than 3 seconds. The angle is also less than 160 degrees. So now I'm going to be looking at your toes. Capillary fill is also less than 3 seconds. They're convex and translucent. There is no clubbing on the toes. So now what I'm going to be doing is I'm going to be looking at your eyes, okay?
Okay.
So eyelashes are bilateral, both upper and bottom. They are symmetrical. Their eyebrows are present. They're also symmetrical. They're brown. There seems to be no lesions or redness. So now what I'm going to be doing is I'm going to be checking your optic nerve, okay? So I'm going to give you this.
Okay.
And you're going to cover one eye and then switch, do the other one, and then you'll put it down. But I'm going to have you look down the hallway.
Okay.
And you're going to describe to me what you see down there, okay?
Okay.
About 20 feet, okay?
Okay.
And I'm ready whenever you are.
I see a white door and a green candle on the wall.
Okay, can you switch to your left side?
And then I see a white door and a green candle on the wall.
Okay, and then can you use both eyes?
And I see a white door and a green candle on the wall.
Okay, perfect. Thank you. So optic nerve is intact. So now, do you wear any glasses or contacts?
I do.
Okay, and do you see your doctor annually for that or as needed? Okay.
Yes.
So now I'm going to be looking at your ocular motor nerve. So I'm going to dim the lights, okay? And I'm going to be looking at your pupils, so I'm going to be shining a light in your eyes.
Okay.
Alright, so let me dim the lights real quick. Okay, so first I'm going to be looking at direct. So I'm just going to shine a light. Look just straight. Okay, they contract. Okay, they both contract. So now I'm going to be looking at your consensual. So now I'm going to just be bringing the light in, okay, to see if they contract as well. Okay. And they both contract as well. The color is black, and the pupil size are 3 millimeters. So now I'm going to be turning the light back on.
Okay.
And I'm going to have you look at the smoke detector up here, okay? And then look back at me. I'm going to bring this in.
Okay.
Okay, so your pupils dilated, then they contracted as usual, as within normal limits. Okay, so now, and that was accommodation.
Okay.
So now we're going to be doing the trochlear and abduction nerve. So I'm going to be holding this, and I'm going to be moving it. You just follow it with your eyes, okay?
Okay.
Okay, and that is intact. Okay, so now I'm going to be moving down to your ears, okay? So the ears seem to be symmetrical. I'm going to just kind of look inside of them, okay?
Okay.
There is no cerumen present on either ear. So I'm just going to be kind of touching. Is there any pain or anything like that?
No.
Okay, I do notice 2 lower lobe piercings. I'm going to be checking to see if they're elastic and they have a recoil, which they both do. And they're also warm. There seems to be no like foreign bodies or anything like that in the ear. So now I'm going to be looking at, I'm going to be checking your acoustic nerve. So what I'm going to be doing is that I'm going to ask you to cover the opposite ear. So I'm going to be whispering something on your right side first. So you cover the left ear, okay?
Okay.
Okay, ready?
Cat, dog.
Okay, and then switch.
Cat, dog.
Okay, perfect. So the acoustic nerve is intact. So now I'm going to be looking at your nose. So the nose appears to be midline. I'm just going to shine a light. The septum is not deviated. So now I'm just going to be kind of feeling. Tell me if there's any pain or tenderness.
There isn't.
Okay, so frontal and maxillary sinuses are without any pain or tenderness as noted. So now what I'm going to have you do is I'm going to have you close one nostril and then breathe through the other one. Okay, and then the next one. So they both seem to be patent. Seems to be no obstruction or trouble breathing. Okay, so now I'm gonna check your olfactory nerve.
Okay.
So I'm gonna ask you to close your eyes. Okay, I'm gonna put something below your nose and I'm gonna have you sniff and I'm gonna ask you, what do you think you're smelling? Okay, what do you think that is?
Coffee.
Okay, that is correct. So the olfactory nerve seems to be present and intact. So now I'm going to be moving down to your lips, your mouth area. So the lips are pink, they look moist, there's no excessive dryness or lesions. So now I'm going to ask you just open your mouth up. Okay, so all teeth are intact. The tongue is also pink and moist. There seems to be no lesions either. So do that one more time and then put your tongue up. I do notice a bottom retainer. How long have you had that?
For 3 years.
Okay. Okay, so the gingiva is also pink. There's no bleeding or lesions. It seems to be that you are up to date on all your dental care. So now I'm going to be looking at your palate. So to open up one more time. Okay, so there seems to be rugae as noted, and then it is smooth as well. Okay, so now I'm going to be looking at your tonsils. So just open up one more time for me. Okay, so the tonsils are present. There's no swelling, no edema. I would rate them a grade 1. The uvula is also midline. So now I'm going to ask you just to swallow and then say ah for me, okay? Okay, say ah. Okay, so the glossopharyngeal and the vagus nerve are intact. So now I kind of looked at your tongue already and I noted that it was pink. It was also moist. It was glistening with the veins and I asked you to lift it up. So when I saw that retainer, so now what I'm going to have you do is just stick out your tongue. Okay, so your hypoglossal nerve is intact. It's midline when you do that.
Okay.
So now I'm going to be moving down to your neck. The skin is continuous from the face. There's no scars or lesions. It looks symmetrical. So now I'm going to be asking you to just do a range of motion. So just kind of spin your head like that. Okay, there is no cracking, crepitus. Can you put your head just forward for me? Okay, and then backwards, and then side to side. Okay, so you're able to extend, hyperextend, flex, rotate, and have lateral movement. So that full range of motion. So now I'm going to be having you, I'm going to put my hands back here, and I'm going to ask you to kind of shrug.
Okay.
Okay? Okay, so your trapezius and sternocleidomastoid muscles are strong, as your ability was to do that. That also indicates that your spinal accessory nerve is also intact because you're able to push against resistance when I put my hands on there.
Okay.
So now I'm going to be kind of moving down, me touching. I'm going to be palpating your lymph nodes, okay? So your preauricular, your submandibular and submental, there's no swelling. They seem to be good. Okay, your postauricular, occipital, tonsillar, superficial cervical, posterior cervical, and then your supraclavicular are also, they don't present any swelling. So I'm going to be looking actually at your carotid pulse. So first I'm going to feel it, okay?
Okay.
On both sides, but one at a time. Okay, and then the next one. So they are strong and equal. They're also bilateral. The rate seems to be normal, regular rhythm. So now I'm going to listen to them. Make sure there's no bruise, okay?
Okay.
Okay, and they do not present with any bruise. So now I'm going to be moving down to just your lungs. I'm going to be listening to your lungs in a little bit, but first I'm just going to look at your skin. Okay. I'm also going to be checking your spine. So you do have that S shape. Have you had any like spinal injuries, issues?
No.
Okay, so that seems to be, normal with my assessment that I did.
Okay.
So now I'm going to be listening to your lungs, okay? Do you have any pain or anything?
No.
Okay. I'm going to be starting in the back. I'm going to move over here. And just take a deep breath and out through your mouth. Okay, so there seems to be no adventitious sounds. They seem clear. I'm going to be listening up front as well, okay?
Okay.
Okay, so vesicular sounds were heard in all peripheral lung fields. Your inspiration is also greater than your expiration, so that is within normal limits. Like I said, they're bilateral, and you didn't have any adventitious breath sounds. They seem to be clear. So I'm going to be checking to see if there's any fluid or anything like that in your lungs. So I'm going to be doing some percussion. That's what it's called.
Okay.
So I'm just going to be tapping, okay?
Okay.
Okay, and they are resonant. There doesn't seem to be any fluid or any buildup or air or anything like that.
Okay.
Okay, so now we're gonna go over it, kind of what we would do if we did a breast exam on you, okay?
Okay.
So what I would have you do is I would first check to see if your nipple is darker, so your areolar is darker. I would also be checking to see if they're symmetrical, and at this time I'd also be kind of palpating, see if there's any masses, anything like that. I'd also be asking if has there been any pain. Has there been any pain?
No.
Okay. So I'd also be checking for like any edema. And also like dimpling or retractions when we did this. So you'd usually do 3 movements, and I'm going to go through the movements with you, okay? So first you'd have push your hands into your hips, okay? And at this time I'd be checking for all that stuff as well, for the dimpling, retractions, and also palpating. So then you push your palms together right here, okay? And same thing, checking for the dimpling, retractions, any masses. And then you would lift your arms above your head. And the same thing, I'd be making sure there's no dimpling, masses, making sure, that your lateral, central, posterior, anterior axillary nodes, they didn't have any masses on them. Okay, so then what we'd usually do, I'm going to have you do it, where you would lay down, just right here. And then I would have you put your hands above your head, and then I would be checking to make sure those nodes that I just went over, there's no palpable masses on them. And then you can also do this at home, so you can just sit back up now. You could also do this at home to, see if you notice anything, but we'd also do this here. Then I would ask you, have you had any nipple discharge, anything like that? And it may be evident from the breast exam if that was there. But I think that ends my health assessment. Thank you.